Okay, I see what's going on. Okay. I am going to turn this over to Dr. Loudermilk. And if I could, there we go. All right, so Dr. Loudermilk, it is on to you at this point.
Okay. Can everyone hear me? Can you hear me, Dr. House?
I can.
Only thing you'd asked earlier, or mentioned earlier, how many people that we're seeing that are really asymptomatic, and I'd say it's closer to 80%. I mean, there's a large portion of the people that we're seeing that are not having any symptoms or very mild symptoms of the virus. So I'm going to try and share. So Dr. House got to talk about the sexy thing today, the coronavirus. I'm going to talk about the influenza virus, and I'm going to be a little bit of a salesman on getting vaccinated. Let me see if I can get this to work the way I need it to. Right. So this is what some practitioners would like to be able to do so that we can get everyone to get their flu shots every year. So just a little brief history on immunizations. We are all hoping that we are going to be successful in developing a vaccine for the coronavirus so that we can get back to more of a normal life as soon as possible. But there's history of immunizations going back to as far back as the early Chinese and African and Turkish history, which is really fascinating. Some of the drawings that they've found suggestive of people being inoculated with things that maybe have been early smallpox or cowpox treatments. So we've had a history of this for a long time, but in modern history, we've slowly gotten a better understanding of illness and infection and how these infections work and how to get our own immune system prepared to fight off a lot of very devastating infections. Just some of the ones that are listed there, the polio vaccine, cholera and typhoid. A big one, of course, is polio. Thanks to the efforts of a lot of different organizations, the Rotary for one, polio has almost been eliminated as a infection or problem now, and of course polio can just devastate somebody's life. So as far as the flu vaccine just to go over some of the symptoms, one of the things that as we're coming into the flu season and with the coronavirus being an ever-present concern, some of the symptoms are very similar. Often will run a fever, there'll be a cough, sore throat, you'll have body aches. Generally speaking, if somebody complains of body aches, it's more likely the flu than the coronavirus. We see more viral illness and more we see more respiratory issues, more respiratory concerns with the coronavirus than we do with the flu. You can get headaches, fatigue. Some people have some GI issues. That tends to be more common in children than in adults. Generally speaking, if somebody says that in the past, if they said that they had a stomach, they have the stomach bug, or they were sick to their stomach, it was most likely more a gastroenteritis than it was the flu. But one of the other symptoms of the flu. Just as the coronavirus, the flu spreads by aerosolized droplets from the cough, sneeze, and talking. Approximately 8% of the population will get sick from the flu each year. Similar to the coronavirus, they're contagious in the first 3 or 4 days after symptoms. They can be potentially infectious up to a day before, and as Dr. House had explained earlier, you're typically, and this is true of what we know of viruses in general, for 5 to 7 days, you can potentially spread it to other people. Some people who are immunocompromised because they're not able to fight off the virus, and they will develop a higher viral load, can potentially spread the virus longer. So I want to visit not just or a little bit about the complications that can occur with the flu. And one of the concerns, and I'll talk a little bit more about this a little bit later, in encouraging everyone to get the flu vaccine this year. If you haven't, I would encourage you to do so. But co-infections, so if, especially with people who already have other respiratory issues like COPD, asthma, when you get the flu, your body mounts its defense against it. Obviously, it can fatigue your body, and whenever you have get that initial infection and then are exposed to another potential bacterial infection like pneumonia, the complication is not that those combine in some sort of a superbug, but that your body is already stressed, and then you have this additional illness that your body's trying to battle, that just stresses it out more. And people who have other chronic conditions such as diabetes, heart failure, asthma, they're at a higher risk. There are some other things that can cause you to have a worse outcome with a flu infection. The chronic heart disease, liver disease, kidney disease, obviously immune suppressed individuals are just at a higher risk of catching the flu virus and having a little harder battle with recovering from it. So ways to reduce your risk of contracting the virus. One of the things that I've told people I'm hopeful for in this flu season that we're going into is that because we're really encouraging people to socially distance, wear their mask, wash their hands, and there's been a more of a concerted effort for that, we may actually see a lower flu season this year than we've had in the past, because all of those measures that we're doing are going to help decrease the potential spread of the flu. So all of those things that you can do to reduce your risk of getting the coronavirus is going to help you to reduce your risk of getting the flu. in the 2019, 2020 flu season, it was estimated somewhere between 24, and that's a wide range, but between 24,000 and 62,000 American deaths were related to complications from the flu. In the state of Arkansas, there was last flu season about 125 flu-related deaths. I would just make a side comment. I think, and Dr. House may help me or correct me, but I think we've seen almost 1,600 flu deaths or deaths related to COVID in the state of Arkansas so far. And that's just to give you an idea of the severity and the issue and why the coronavirus is such a health concern. The flu is a concern, and it is certainly a problem, but we're seeing far more complications and poor outcomes related to coronavirus infection. The CDC recommends that everyone 6 months or older should get the vaccine. Individuals that are 65 and older should get the high dose Fluzone quadrivalent vaccine. It has a higher antigen content in it. It helps to provoke a stronger immune response, which hopefully will encourage these immune systems to have a little bit longer and a better coverage. It's also recommended that it takes about 2 weeks for to get to maximum immunity. This year, because of the coronavirus, the CDC was recommending that as soon as the flu vaccine was available, that people should start getting vaccinated. And that was back in September. We've done a good job. We've had a couple of the clinic here in Eureka Springs. We've had a couple of flu clinics. And I think in 2 days of vaccinations, we vaccinated a little over 500, almost 600 people, which we were glad to do and glad to get that done. There are some contraindications to getting the vaccine. Those are actually very few. Most people, it's safe and they should. People who are immunocompromised, pregnant women, and some adults, the live attenuated virus is not really recommended. Who decides on what flu viruses we vaccine against each year? Well, the World Health Organization and the CDC and actually the European Health Organization look at the preceding year's flu season and what was the prevalent flu strains, because there's many strains of the flu, and they decide on or identify which look like to be the predominant strains that they can develop enough of the vaccine and a high enough quantity of the vaccine to treat the flu for the upcoming year. They usually decide that in the February of the year before or of that year. They typically choose, there's one H1N1 strain, there's an N3, N2 strain, and then they also include an A and a B strain of these, of the flu virus that they use to, as Dr. House was talking about, one of the things that happens with the virus is that it can drift in its genetic makeup. One of the things we're seeing with the coronavirus, as he had mentioned earlier, is that we're seeing slight changes or variations in that viral makeup. Well, that's very common in the flu virus. And so we have to identify whatever is the predominant strains that we think are going to be the most infectious for the year. Side effects to the flu vaccine is fever, some temporary pain, muscle pain and aches, pain in the in the injection site. Some people will complain of some fatigue. With the higher doses, there have been some reports of some stomach upset. In very, very rare cases, there's a disorder called Guillain-Barré. As I've noted there, it's like 1 to 2 in a million, but it is a serious complication to the flu virus, and can have long-term implications on a person infected by it. So again, how do you prevent the flu? Get the flu vaccine. There are the treatments that we have available right now. We do have several antivirals that, if given within the first 48 hours, tends to shorten the duration of the flu. It doesn't technically, it doesn't really cure the flu, but it does shorten the duration. It's recommended. There are some other vaccines that in immunizations that I would recommend. One, obviously, I would recommend getting the flu vaccine every year. If you are not up to date on your other immunizations, I would encourage you to talk to your doctor about them. There's one specific vaccine that two specific vaccines that I wanted to visit about just a moment. The Shingrix vaccine is a newer vaccine to treat for shingles. If you have had the earlier Zoystervax vaccination, you would still benefit from this new vaccine. There's having treated several people with pretty severe herpes shingles outbreaks, it can be very devastating, and can have. I have a few patients that have had very severe shingles outbreaks, and they still to this day suffer from chronic pain related to those outbreaks. This vaccine is significantly provides significant improvement over the Zoystervax vaccination as far as the immune response. It shows almost a 91% effectiveness, which is impressive even for vaccines. So I've encouraged most of my patients to get this vaccine, and I would encourage you to look into it and possibly get it. The other is the Pneumovax vaccines for older patients. There has been documented evidence that getting those vaccines will protect older at-risk patients from having, it won't stop them from getting pneumonia, but it reduces the severity and can potentially keep them out of the hospital, which is a good thing to do. So this is just a side little funny that I saw on the internet. This is the resources that I got, and this, our dog, we have a new dog. She's about a year old now. Her name is Raisha, and right now she's trying, and I don't know if the cat is trying to kill the dog or the dog is trying to kill the cat, but they are at odds with each other. So with that, Dr. House, I would open it back up to
All right. So
questions for everybody.
Yeah, I'm going to stop recording at this point. I don't think we need to record the questions.